Hi, I'm Dr. Hansa Bhargava, WebMD medical editor, and today I'm here with Dr. Daniel Kraft. He's the chair of medicine at the Singularity University, a practicing pediatrician and a father. Thank you so much for being here.
Thanks for having me.
Well, let's jump right into it. So we're talking about wearables. We're all excited about wearables. They help keep track of steps, sleep, other information, but now it seems that many of us end up with a bracelet and a desk drawer. Why do you think this is, and do you think this will change in the future with the new technology that's coming?
I think we're still in the early era of wearables and quantified self. I'm wearing, a connected watch and another thing that tracks my steps and my sleep. Now some of these have batteries that last 8 months or more, so they don't get lost in your drawer without a charger. But what's interesting about these is they can give you insight as a consumer to be empowered with your own data, whether it's your steps or your sleep, where you may have been. But we're going to see these being connected back to your clinician, from quantified self, tracking single pieces of data, to quantified health, where it flows into your medical record, can help impact management of chronic and acute diseases. And we're moving from sort of the accelerometer, the basic sort of wearable device, to this era of insidables, contact lenses being developed that can track blood sugar. This idea of trainable, something that can give you feedback. For example, a common medical issue is lower back pain. There are now little devices like this one called the Upright that you wear on your back, and it'll buzz you when you're hunched over for too long on your smartphone or your laptop. And with a few
we could all use that.
Yeah, wear it for a week and you're trained back up to sit up straight. Your mother, your digital mother in a sense. So I think we should think beyond wearables. Wi-Fi now can pick up our vital signs. There's mattresses that can track your sleep, and sleep is so important. We know that sitting is the new smoking.
Right.
Our wearables can start to nudge us to stand up every hour if we're at work or otherwise. And they'll be contextual and tied with sort of smart coaches that are going to be like an OnStar for the body that'll know, hey, Daniel, go right to that gym class and not left to the fast food restaurant.
Right.
And be part of integrating our data, not just through steps and sleep, but with our holistic life, wellness, diagnostics, and therapy plans.
So it sounds like they're not just going to be providing data for you, but actually having you act on it.
Right, because actually no one wants to look at the raw data. It's going to be a matter of having a dashboard that integrates for you and matching your behavior type, your incentives. Some people want points or badges or dollars to stay healthier or to manage their disease. And again, a lot of these will disappear into our clothes. There are now connected diapers and connected onesies. We're going to see them embedded in our cars and our connected homes. This Internet of Things is coming to the Internet of the body. And these wearables are just the beginning of this era. It's going to be a very exciting age where our digital exhaust can really start to inform us and empower us as individuals and as doctors to help our patients live healthier lives.
Well, that sounds great. I mean, it would be great to actually help compliance, back pain, diabetes, with all of those. We look forward to hearing more about that. Thank you very much for being here, Dr. Kraft.
Thanks.